Welcome back to the Woven Well podcast. Maybe you've heard a joke or two about how dangerous it is for women of a certain age to sneeze or laugh too hard because they may pee their pants if they do. Well, many of us women wonder, is that really true? Do women just lose the ability to hold their bladder as they get older after they have a baby? Like, what is it that actually causes this? And is it something that can be avoided? Well, it turns out it's all connected to the pelvic floor. And pelvic floor issues are not reserved for just women who have had babies. Pelvic floor health can benefit each and every one of us, whether you're a mother of small babies, single and in your 40s, married and not planning on having babies anytime soon, or approaching perimenopause. So, in today's episode, I've invited Dr. Erin Suellentrop to teach us the basics about pelvic floor that all of us need, not just the mamas. Dr. Erin is a doctor of physical therapy and the founder of Adapt Physical Therapy in Wichita, Kansas, where she specializes in orthopedic and pelvic floor physical therapy. She helps women improve their pelvic floor to feel better in the gym, in the bedroom, and in their daily life. Dr. Erin, welcome to the show.
Hi, thanks so much for having me.
I'm really glad to have you here. I first heard you at the AAFCP conference in 2025, and I really appreciated your approach to women's health and pelvic floor health, especially. Of course, I can only refer clients to you who live in your area, but I wanted to have you on the show to share some of your wisdom and experience with our listeners. But first, what drew you to want to specialize in this specific area?
So, it really wasn't something I was super interested in until my last year of physical therapy school. At the joy of welcoming my first baby, my son Levi, and it rocked my world in so many ways. It was wonderful. But I was really, even despite knowing everything I know, literally studying for physical therapy at the time, just unprepared for the toll it can take on you physically, and how little there is to help women going through that postpartum. So it piqued my interest a little bit more into the pelvic floor. It's not something that's really touched on in depth in school. You have to go on and get further training and certifications to do. And so as I got deeper and deeper into learning about it, I realized, that, like you said so beautifully, there's so many women that benefit from this, not just postpartum. They could have never had a baby before. They could have a condition like endometriosis or really painful periods, and pelvic floor therapy could be super helpful for them. So that's why I'm really passionate about just helping such a need in the community.
I appreciate you saying that even you didn't know a lot about it as a physical therapist because it makes all of us feel a lot more like takes the pressure off because obviously it's something that you can't see. You can't see your pelvic floor, and it isn't often explained to us, just the
Sure.
women out there in the world. So if you were going to explain it, how would you start?
So the best way to think of it is picture a cup or hammock shaped group of muscles and connective tissue at the bottom, spanning from your tailbone all the way up to your pubic bone in the front. Okay. So kind of cup shaped like this, right? These muscles, just like any other muscle, can contract and they can relax. And their role is obviously to help with having sex, but also going to the bathroom. And then just by where they lay, kind of at the bottom of your torso, they do provide some support for all of your internal organs as well.
Yeah, that's very helpful to think about, especially the support for internal organs. Sometimes we hear about it with postpartum or with the intercourse, like you mentioned, but we don't think about the organs very often. So that may come up in some of the stuff we talk about. But today's episode specifically is about issues that aren't isolated to pregnancy and postpartum, although obviously there are many in that category as well. And we do have some previous episodes on that. But can you walk us through what some of those issues may look like outside of pregnancy and postpartum?
So, an interesting statistic I thought you might be interested in knowing is actually 67.5% of women at some point will experience pelvic floor dysfunction. So, it is incredibly common. Now, this could be just pelvic pain from a sports injury, from a car accident, from a clumsy trip and fall. It could be really, really painful periods where we know, this is more than just the normal monthly cramps. There's something else going on here. Could be from an underlying condition like endometriosis or PCOS. And then beyond the pain, you could also have issues with your digestion, with constipation, or with leaking.
Are those really common issues that we don't realize are, I mean, I'm assume they aren't always associated with pelvic floor. Is there a way to know if it's your pelvic floor that could be contributing to it in some way?
Great question. So, this is where I really think it's important to schedule an appointment with a physical therapist because, if you sign up, it's not like you're committing to a set number of weeks in therapy. The therapist's job is to evaluate you and see if there's anything in their tests that shows, hey, this could be contributing to your symptom because when we do this test, that's the pain you were experiencing, or this is if we loosen this up, then your bloating gets better. So a lot of the hands-on techniques that a physical therapist will do can kind of figure out if that's what's impacting it or not.
That's such a good point. And it sounds like there's some experimenting involved in it to see, you try different things out and see what's the effect. Do you see a noticeable improvement? And that could be a really good sign of it as well. So, are there things that we can do on our end? Like, let's say we want to schedule that appointment, but it's going to be 3 or 6 months before we can actually get in with a doctor. So, are there things that we can do on our own that can maybe improve it?
Certainly. So there's a lot of things that can impact the pelvic floor beyond just strength of the muscles. They could be really, really tight. And so there's different stretches you can do to help with that. Also, posture. I always ask my patients about their posture. And this isn't just do they tend to slouch a little bit, but anytime someone tends to always kind of shift onto one leg all the time, or they're always crossing one leg, that can cause certain muscles in the pelvic floor to get really tight. Yep,
Guilty.
Me too. I've been there.
I sit
Absolutely.
like that all the time.
Me too. The other one that really gets a lot of people is unconsciously clenching certain muscles. So this could be every time you stand and doing dishes, you're just lightly tightening up your glute muscles a little bit without even thinking about it. And a lot of times these happen more around your period too. So particularly if you have a condition that causes inflammation, you're going to be more tense. You're going to do some of these patterns where you're clenching your lower core, clenching your glutes, and that can make a lot of the symptoms worse.
Wow. And that is so interesting to think that how we stand or sit can make such an impact. Maybe just noticing, maybe just paying attention to the way that we sit, paying attention to the way that we stand.
Yeah, absolutely. Just starting, I'll always tell people, start a little journal of, I'll give my topics of what's your posture like most of the time. It's okay to shift your weight to one leg sometimes, but if you're stuck in that same position the majority of the day, that could be contributing to some stiffness. Also habits. So one habit that a lot of people don't even think about, myself included until I learned about it, was peeing just in case before you go out to run errands or when you're traveling. If you're always peeing just in case before you get out the door, you're not really feeling like you need to go, but you just want to make sure you're empty, that can actually cause your bladder to become more sensitive to pressure of the bladder filling. And so over time, that can contribute to leaking.
That is fascinating because I've always heard if you wait too long, if you hold it too long, how bad that is for your bladder. But I have never heard anybody talk about how bad it is to go just in case. So that's really helpful information to know. There is a sweet spot, and it's the way that God designed the body.
Absolutely. Somewhere in the middle is where the answer lies.
That's right. We just stay in the middle. That's good. So there are so many different things that we could do, and you've given us a lot of different suggestions just for getting started now before we ever meet with a physical therapist. If there was just one of those habits that you would encourage our listeners to start today, which one would you want it to be?
Ooh, great question. I would say actually something I haven't brought up yet, but is
Okay.
super important. It's kind of a test you can do on yourself to see if this is something that's hard for you. But you want to work on diaphragmatic breathing. So we've talked about the pelvic floor and how it's those muscles all the way at the bottom, but they don't work by themselves, right? Everything else in your body can impact it, especially the muscles around it. So at the top of your torso, you have your diaphragm that contracts and relaxes as you breathe, and then your core that goes all the way around front to back. So it kind of picture it like a cylinder with all these different muscles that work and contracting, relaxing in this pressurized system. So when we breathe from our diaphragm, we want to make sure all of these muscles are contracting and relaxing together. We don't have an imbalance where maybe, we take a big deep breath and our chest moves a lot, but our lower body, our lower abdomen stays super still. That can cause a lot of stiffness because normally when you breathe, you should kind of feel your lower belly and your chest expand together. So to explain it a little bit more in depth, the test you do is you put a hand on your chest and a hand on your belly, and you just take a big, slow, deep breath in and out. And what you should be feeling is you should be feeling that both hands kind of move outward together as you breathe in and fill with air, and they come back inward as you breathe out. Now, if this is difficult for you, don't freak out. A lot of times it takes some focus and intention to kind of work on this, but that's a good way to practice body awareness and learning how to use all those muscles together.
Yes. And I love the mentioning of body awareness and the fact that we can adapt, we can respond to it, we can make changes. Uh, so often we think, oh, well, this is wrong with me, or I have this diagnosis, and it feels like, well, that's it. This is my life for forever. But
Mm-hmm.
obviously, there are ways to improve it. And the fact that you can just start by being more aware of your own body and doing something like deep breathing and paying attention to it, I hope that's really encouraging to the listeners. It's encouraging to me. Now, a lot of our listeners are involved in fertility awareness methods, specifically the Creighton model system. I'm just curious, have you ever seen any patients who use Creighton?
Yes, I have seen several patients that use Creighton. And I think the biggest thing that stands out for these individuals is they are already very used to practicing body awareness, right? They try so much about their mucus, about, other things in their day to day and their health. And so just already being kind of tuned into what that looks like and having a routine with that makes it a lot easier when you start working with a physical therapist to learn how to work with your pelvic floor and understand your symptoms and describe your symptoms and notice when things are a little different. One thing in particular that a lot of the patients that I've worked with that I've used Creighton is they notice that correlation with their cycle. So I'm thinking particularly of women that I've seen that have had endometriosis or PCOS. When they are doing their charting and they're seeing something's happening in their cycle, that can cause their symptoms to get a little bit worse with their pelvic floor. As I kind of
Mm-hmm.
mentioned earlier, the inflammation can play a big role in that. And then also, a lot of times we don't realize this, but paying attention to your own response to pain and symptoms. So when you're in pain, we kind of focus on that pain. We have a tendency to not think about anything else. And that can actually make you get even tighter and make those muscles a little bit more guarded or a little bit more sensitive to different things. And so that can definitely contribute. I'm not saying it's in your head. I'm not saying that at all. But having knowledge of what's going on with your body and learning that there are things that you can do to help about it, especially on something like this that's not something a lot of people want to advertise or talk about, can be really, really empowering.
Yes, it's such a good point. Not a lot of people want to talk about it, but so many women are dealing with it every single day. I'm
Mm.
thrilled to hear, although not surprised, but I'm thrilled to hear that those using Creighton are already a little bit more aware and specifically aware of when things are happening in their cycle and they have that bigger context to contribute to it. I would imagine that it probably is helpful on your end too to have that information and to be able to see how things increase or decrease throughout a cycle. So now, if someone is interested in getting these issues resolved, I'm assuming that there is going to be a point at which it is going to be more efficient, just a more necessary course of action to actually work with a pelvic floor therapist instead of just doing things on their own. Is there generally a guideline or kind of some symptoms that you're like, okay, this is the point where go ahead and come in, like we really want to help you get this resolved quickly?
Yeah, absolutely. I think the biggest thing is watch for symptoms that you know are just not normal or not something you should be dealing with, right? So if I have people that complain, they say, "Oh, it hurts when I have sex," or "I just feel so constipated and bloated all the time. I leak whenever I laugh or I run or do jumping jacks. It feels like there's pressure down there. I just feel tight all the time." Anything like that, that is a flag to me that there's probably something going on with your pelvic floor, or it's at least getting checked out.
And notice, listeners, that she didn't say if you've had a baby and these things have happened. It's just if you're dealing with these things, period. So everybody deserves to get excellent quality care for pelvic floor. And it is not restricted just to those ladies who have had babies. So,
Absolutely. Yes.
well, Dr. Erin, thank you so much for coming on the show and for sharing this. It's very, very helpful. And I know our listeners appreciate it.
Oh, you're so welcome. Thank you so much for having me. I've really enjoyed it.
Listeners, there is something that we can all do to invest in our own pelvic floor health so that we do not have to live into the stereotype of the older women who pee when they sneeze.
Amen.
And I'm. No, I'm really relieved by that. So, if you are looking for resources related to that, I will certainly have Dr. Erin's website listed in our show notes if you live in the Kansas area. But we also have other resources that we would love to help you with as well and get you connected to some really good support in your area. And if you're looking for a place to receive education and empowerment about all things natural fertility while still honoring the connection between your fertility and your faith, you found the perfect place. That's what we do each week here on the podcast and through our daily work at Woven Natural Fertility Care. So if you'd like to learn more about us, we'll have links to our websites in the show notes. As always, thanks for listening as we continue to explore together what it means to be woven well.